I feel my work is impactful, particularly when I get to see the results of my efforts. I get to see like businesses be responsible, making improvements to make sure they don't harm the environment or they don't cause adverse impacts to the community. I see, developments being built sustainably and making sure they're in harmony with the community. I get to see, contaminated properties that gets redeveloped, put back to productive use, including sometimes as, public spaces or community gardens.
I like working in public health because our communities, especially the community that I'm from, really benefits from the services and initiatives.
I know our work at CDPH is impactful because I look at the data. I'm able to see what's happening at a community level, not just an individual patient level. And when we see communities in Chicago that have often been left behind, really moving up to have health outcomes more comparable with wealthier parts of Chicago, I know we're making the kind of progress we need to make in Chicago.
I think one thing that people may not realize about public health is there's a lot of variety in the type of work one can do to affect health outcomes. I like that I have the opportunity to work with colleagues that do impactful work across public health disciplines, which is essential in the emergency preparedness field.
I love working in public health because I've always been a big picture thinker. I'm a doctor, so I do take care of individual patients, but in my work at the health department, I get to think about the whole city. Who are we leaving behind? How do we build systems that actually allow all Chicagoans to live healthier lives?
I love working in public health because it gives me the opportunity to connect to those communities, to minority, underrepresented, people that look like me, that speak like me. And with that linguistic and cultural concordancy, we can impact, educate, and come together with community-driven solutions.
Can we think about policies? What can we do with environments? How do we build systems? It's that big picture thinking that really keeps me interested in this work, and it's with the amazing team at CDPH that turns that into a reality every day.